Inflammation. Inflammation is defined as the response of vascularized living tissue to injury. Hence, on the clinical force of the tissue reaction, it is divided into two categories: acute inflammation and chronic inflammation. Acute inflammation. This is characterized by the vascular and cellular events resulting in a more or less stereotyped response of the exudate of polymorphose. Polymorphose are the historical hallmark of the acute inflammation. Depending on the relative compositions of the fixed component, the exudate may be serous, that is watery, filous, and fibrinous. Fibrinous, it means protein rich with the fibrin strands, suppurative in pus, rich in the polymorphose, hemorrhagic, that is vascular damage, and RBC extravastations or necrotizing, that is accompanied by the tissue destruction. As the inflammation subsides, or if it is due to the infestations of the allergic reaction, eosinophils may be seen in the significant number along with the variable number of the plasma cells, histiocyte and leukocyte. The example of it: acute appendicitis, acute meningitis, and allergy may be seen. And chronic inflammation. Inflammations may follow a chronic force under the several situations. Number 1. Following acute inflammation, if irritated stimulus persists or if debridement and the healing are apart. Example: ulceration in effective immune response or therapy in bacterial infection. Number 2. Repeated bouts of the acute inflammations. Chronic pyelonephritis and insidiously as chronic inflammation spreads. This could be due to the virulent organism or non-degradable material that resist radiations, and the associated element of immunoreactions may play a variable role. As example, tuberculosis, fungal infection, cholesterol-rich exudate, foreign body like asbestos, silica in the lungs, and rheumatoid arthritis and the autoimmune disease. Repair and healing. After acute inflammations, outcome may be: number 1. Resolutions of the exudate by enzymatic lysis and phagocytosis. If associated tissue loss is minimum or the tissue is capable of regenerating the lost cell, total reconstitution of the tissue to normal state occurs. And the number 2. Healing with scar formation by granulation tissue. This occurs if exudate is reached infinity, resulting in adhesion as in fibrinous pericarditis or peritoneal inflammation. If there is significant tissue loss or if tissue is not capable of regenerating the lost parenchymal cell.